You're listening to Pedia Pain Focus, episode number 20. Today's guest shares some simple mind shifts and skills which help your transformation from a qualified clinician into a skilled, compassionate, and expert healer. And you can instantly and effortlessly engage your patients and families into becoming proactive partners in their own healthcare, in their improved healthcare outcomes, and not just becoming satisfied customers, but some of your raving fans. So, stay tuned.
Pedia Pain Focus.
You're listening to Pedia Pain Focus, brought to you by Proactive Pain Solutions. Pedia Pain Focus highlights pediatric pain information and provides tools and resources for all healthcare professionals taking care of children dealing with pain. Here's your host, Dr. Anjana Kundu.
Hi there, this is your host, Dr. Anjana Kundu, welcoming you to another episode of Pedia Pain Focus. Thank you for joining me for another discussion. And today we are going to be talking about some of those quotes unquote soft skills in medicine. But I actually call them essential skills because I feel they are the glue that holds the entire discipline of compassionate human care that medicine is. I'm talking about the skills of empowering your patients, engaging them, the communication skills, And these skills are even more integral to practice of pain medicine since pain is such a subjective and personal experience, and it's influenced and determined by so many factors, more than just those nociceptive inputs. And we know that this is especially relevant during this time, during the COVID-19 pandemic, when our patients have very limited access to our technical knowledge, our direct communication, the medicines that we can write for them, or the procedures we can do for them. So at this point, we need these skills even more so than ever to make sure that our patients are feeling empowered and engaged and that they are feeling confident about self-management during this time of limited contact. So my today's guest, Miss Laura Wieck, is an expert in these skills. And to be honest, initially we were going to talk about her massage skills here because she is a massage therapist by training. But her approach to massage therapy has always been extraordinary, exemplary, in that she always offers her patients a truly integrated, holistic body and mind therapy, which carries out even beyond her treatment room, which is where we need that empowerment and engagement, right? I have seen her pediatric pain patients thrive and become highly functional and empowered. Additionally, I have personal experience. I've personally benefited from her unique skills as my own massage therapist as well. And to tell you the truth, her success with her patients and clients led her to becoming an entrepreneur. She's the creator and founder of BodyMind Coaching with Laura Wieck, which helps massage therapists and holistic practitioners incorporate a powerful coaching process in their healing work. Her mission is to help the world connect back to their bodies, tune into their intuition, and live a #body-mind connected life. Now, I know some of you may be thinking, we don't necessarily have a hands-on practice like Laura's teaching or Laura's helping those practitioners. And you may be thinking that my patients are coming to me because I'm an expert who can offer them the information, the techniques, the skills to treat their pain. And I am being referred these patients because I work in a hospital or a practice setting where I get lots of referrals. Fair enough. But think about this. Your patients and family's satisfaction is paramount. First of all, for your own professional and personal satisfaction. Let's be honest. We all want to feel fulfilled as clinicians. And that's why most of us, at least, went into this profession in the first place. Secondly, your professional performance is partly evaluated based on the patient and family satisfaction, which is increasingly being tied to the reimbursement that your hospital or your practice receives from the third-party insurers or Medicare, Medicaid, whatever your distribution may be. So your empowered, compliant, and engaged and satisfied patients and families mean a better performance in all these spheres. And see, if you're thinking, I'm not a massage therapist and it doesn't really matter, think about it. You are a therapist. You're a clinician who treats patients. Trust me, regardless of your practice setting, years in practice, or your technical skills, or your experience, or your knowledge, you will definitely learn practical skills that no training in medical, nursing, or other professional school teaches you, and which you will be able to put in practice right away. So, without further ado, let's welcome our today's guest, Miss Laura Wieck.
Laura, welcome to Pedia Pain Focus.
Hi, Anjana. Thank you so much for having me. I'm excited to be here with you today.
I'm so delighted you're here. And I know, you have so much to share with my audience besides your clinical skills and incredible skill set that you have as a massage therapist, but even more so as a very gifted body-mind coach.
Yes.
So I am so excited to tap into your expertise and share that with my audience today. And Laura, I know you, I've known you, and I'm a big, big fan of yours, besides being so thrilled to be your friend. I would love for you to tell a little bit about, in your own words, who you are, what you do, and how you impact lives.
I feel like you just did a beautiful job of sharing that. So, my journey began a long time ago, but when I randomly found myself in massage school, that was never the plan. And somehow through life circumstances, I got into massage and just really fell in love with the work. My degree is actually in biology. My background's in biology. So I love anatomy and physiology. I love understanding how the body works. And when I fell into massage, it was this perfect combination of that anatomy and physiology that I love combined with helping people feel better. So I loved the connection and I loved the people and I loved the work itself. So it's, I always say that massage called me and, this is never something I chose. But what kind of happened in this, just I felt prepared when I graduated school, and I see this in so many of the clinicians. By the way, apparently you're going to get a little bit of a background story, so I hope that's good with your audience. But
that would be lovely.
Okay, fantastic. So when I started practicing, and again, I see this with so many clinicians, is I felt so confident and I felt like I was really good at the treatment and what I did. In Ohio, you actually have to pass, at the time you had to pass a medical board exam to get your massage license. And I passed in like the 97th percentile. So I felt ready to help my clients and treat the body. And then what started to happen is my clients started sharing their stories. They would get on the table and start talking. You would have it hurts here, my shoulder hurts, my back hurts, this aches, all that stuff. But then they would start to talk about, their boss constantly looking over their shoulder, or that person who was being a pain in the butt, or, the stress and overwhelm, that they were feeling in their relationships, the worries that they had. I would watch moms who worried about their kids, grown children, adults in college. I would watch moms who worried about their kids, like literally contort their body as if they were trying to cradle them as if that they were still infants. And so I started to see this whole like body mind thing in action. And I started to get curious. And that's really where I realized that it wasn't just the physical symptoms of what they were presenting with, is that there was this whole mindset thing that was happening in the background. And that's where, I realized that if I wanted to really help people, a couple things had to happen. Is one, I had to be really mindful of how I talked to them, because how I talked to them actually started to guide the session. And I realized a mistake that I saw with a lot of massage therapists. And actually when I got into doing pediatric massage, I saw this happening, no offense, in a hospital setting, but I realized that how you talk to clients can dictate how they feel and how they feel in their own body. So I saw that. And then I also realized, like,
tell me more. What do you mean how they feel?
Okay. So the questions that we ask are, I know you say patients, for me, I say clients, but the questions that you ask your clients or your patients is what they're going to focus on inside. So a great example of this is, I'll do it from my private practice side of things, and then also from what I experienced in the pain clinic. When my clients would come in and they'd say, hey, my shoulder hurts. Okay, great. I'll work on your shoulder. And then after the treatment, if I say, hey, so how is your shoulder? Is that shoulder pain still there? What happens is they are still rating their pain. So even if their pain has improved, they walk out of my door focused on measuring pain. And so I'm actually creating a neurofeedback loop to keep them focused on pain. And, I have a story about when I worked at the pain clinic. I had a patient there that, first of all, she had JRA and fibromyalgia. And it literally took about 2 months for me to actually put any pressure on her body. So those first 2 months, I was just building connection and building rapport so that she would trust me. And so what was happening is in those sessions, at the pain clinic, patient comes in, you ask them on a scale of 1 to 10, what is your pain? And then I would do the session. And then at the end, on a scale of 1 to 10, how's your pain? And what I was doing is I was training them to measure their pain, even though the session was designed to help them feel better, to measure pain. And so what I did instead, and I did this with my private clients as well, is we created the opposite pain scale with my patients. So I would ask them, okay, so what's on a scale of 1 to 10? What's your pain starting off the session? And then I would say, so if we were to flip that, instead of measuring and thinking about your pain, I want you to think about, how do you want to feel? And so we would create this opposite pain scale, right? So a 10 on the pain scale would be a 1 on this scale, So this particular patient came up with the word fluffy. She's like, I want to feel fluffy. And all of a sudden what's happening is I could actually speak to the fluffiness. I could speak to how she wanted to feel. And I could actually use the treatment itself as well as the conversation to guide her in a space where we were feeling the fluffiness and expanding the fluffiness in her own body. And from there I said, so she picks the word fluffy, and I say, so where do you feel fluffy in your body now? And this girl was always a 9 out of 10, 10 out of 10 on the pain scale. And she stops and she pauses. And for probably the first time in the longest time, she actually scans her body to look for something good. And she comes back and she says, in my pinky finger, I feel fluffy. I was like, great. And so from there I said, so what type of massage feels fluffy? What kind of movements feel fluffy? And she let me touch her. She let me actually, she told me soft strokes felt fluffy, and we felt and we played with the fluffiness. And I asked her what needed to happen for it to move from her pinky finger into her other fingers. And then from there into the palm of her hand and up her arm. And we ended up in the 45-minute session. We got the fluffiness from the pinky finger of one hand all the way across her shoulders and to her other hand. And I left and I said, okay, so now on a scale of 1 to 10, how fluffy do you feel? And she left. We started to use that conversation to say, okay, now when you go out from here, I want you to start to notice where you feel fluffy. What feels good? And that little shift, and I did it with my private clients too, grown adults, they would come in and they're all stressed out and they're complaining about their pain and all this stuff. And they would come in and I would listen, and I would, of course, do that intake and that evaluation. And then when I was done with that, I would say, okay, great. Thank you for the information. How do you want to feel? Because my treatment, it was a big shift for me to, instead of treating what was wrong, I used the treatment to guide them towards what they wanted.
So future pacing, not even future pacing, but giving them a vision to look forward to. Okay.
Well, and I think that's the thing with pain. I mean, and from a survival standpoint, the way our brains work is that we are, you probably have better language around this, but we are prone to look for what is wrong. When pain comes up, there's a survival instinct that shows up, and we tend to focus on the pain. And, from that spiritual, the energetic perspective, what you focus on expands. So what happens is when somebody's in pain, they continue to amplify and have this mindset feedback loop where the pain, they're focusing on that, and it grows and it grows and it grows. And I realized that if I structured my services to treat pain and to focus on pain. And this was really a mindset shift for me. I'm only perpetuating a cycle of pain. Even though my intentions are good and I want the best at the end, if I go in there with I'm here to treat pain, that actually did not help them move out of their pain. And so there was a big mindset shift for me of, okay, my job is actually to help move them towards how they want to feel. Well, I suppose if we're going to go into what brought me here in my personal journey was, for me, my degree was in biology. I actually wanted to be a marine biologist, and I was teaching marine ecology in the Bahamas after college. And on New Year's Day 2003, I was going to go scuba diving with my two best friends. And at the very last minute, I changed my mind. And my friends went out for the dive, and then they never surfaced. And we never found their bodies. We have no idea what happened. And that really started for me a period in my life where I struggled deeply with depression and survivor guilt, because I lived with the belief that I could have stopped them, or, if I had gone with them, then I would have gone with them. And just, that what was so interesting in that space, and everything happened, and all the people around me in my life were like, it's not your fault. Don't feel guilty. A lot of people said, don't feel guilty. Don't feel guilty. And I got this message over and over again of don't feel. And about a year later, I actually started experiencing chronic hip pain. And for myself I couldn't sleep. It was constantly achy. It wasn't super severe, but it was starting to be annoying, and it just continued. I went to chiropractors and all sorts of stuff. I saw doctors, and I'm like, why is this hurting? And this was when, in this series of events, this is actually when I randomly ended up in massage school. And my massage professor made a comment one day about how people tend to hold their emotions physically. And oftentimes pain and stress in the body is unexpressed emotion. And that was a light bulb for me. That guilt that I had held on to, that I was told not to feel, was expressing itself in other ways. And so my personal journey was really a lot of healing around the guilt and the shame that I had felt from that experience. And this is where, I know I'm talking to physicians, so I feel a little like I go a little bit on the woo-woo spectrum, but I started to give my body a voice, and I started to actually grieve all the things that I felt. And that process of really tuning in and feeling into my body, being present to what was showing up, but then also starting to ask the question of, how do I want to feel? I do want to feel at peace. I want to feel like I did my best. And I really started to process the emotions that were there, but starting to feel into and guiding myself into, how did I want to contribute and use this pain, this stress, this situation in my life to help others. And so, and again, it's, when I was going through massage school, I was kind of going through with that was just an offhanded comment that he had. And massage school for me was really a place where I actually came back into contact with my own body. And I mean, not even just the accident. I think, girls, women, all the body issues that we have and how we're supposed to look and feel. And there's so much that is taught, the body in our culture has something that we sculpt, we perfect, we push, we hustle. The body is something that is somehow become a tool instead of becoming, to me, it's a source of wisdom. It's like the expression of life itself. We have this really weird relationship with our bodies. And when I stepped into massage school, it was like I had to find myself again in a different state that I had never experienced before. And so for massage school, for me, I really I tuned in and I listened, and I felt amazing. I mean, who doesn't love getting massage every week, for 2-3 years straight? I felt amazing. And then, but when I started to practice, I was like, all of a sudden I thought, oh, it's just me. And then I saw my clients with those same stories, those same moments. And it wasn't, I think, so much of the stress, the chronic stress that we have. And I really feel like chronic stress is your body's way of saying you are not making the choices that you need to be making in your life. My story was an extreme situation. And yes, I think so many of our clients have those moments of trauma that do get stored in the body, and just the chronic stress. And I think physicians deal with this too. The chronic stress of busyness. Stress has become a badge of honor when I don't think it should be. Busy is like the new black. Everybody needs to be busy or else we're not contributing. And everybody is dealing with this chronic stress that I really feel is detachment. They're detached from their own bodies. The body has become something we fight.
So the way I'm hearing this,
Yes.
I'm just I can, as you said, like, getting into the woo-woo stuff, I don't necessarily think, yes, we can call it woo-woo stuff, but really what you're bringing back is that mind and body connection, that connection of our physical being and our emotional, spiritual, cognitive beings, right?
Yes.
So it was never meant to be two beings anyway. We are just one. It's just
correct.
How much focus or in tune are we with each aspect of our life? And I guess what I'm also hearing is it's more about how balanced is your awareness of yourself as your whole being that really determines where we are. So of course there are many of the old wisdom healing systems like the Ayurveda, which is the ancient Hindu healing system from India, or the traditional Chinese medicine system. They all believe in sort of these life source and the balance of basically this flow of these life sources or energies or spirits through our bodies. And when that's in imbalance is when we have physical symptoms. Yeah. And a lot of these cultures already believe that once you start seeing the physical symptoms, which is what we see in our traditional Western medicine as the diagnostic or clinical signs, that it is actually kind of too late. We've let it go too far. Yeah. However, even if we've it's like, yes, we've let it go too far, but it still is valuable to recognize that that's the intensity of the imbalance. And now we just need to bring it back where we can't just focus on one aspect of our being and hope that your entire self will feel better. So basically what I'm hearing is it is important to assess the entire person's being.
Yes.
There are still, even in highly trained medical systems, there's the popular belief that pain is a symptom of something else being wrong. And in a way, like you said, yes, pain can be a manifestation of an imbalance somewhere else, as we were just talking about. But it's not just a symptom that can be treated in isolation by just focusing on the symptoms. You have to get to the root cause.
Yes.
Great. And the other thing that, Laura, I was also hearing, or at least that was my understanding, and correct me if I'm wrong, is when you're assessing your clients and your patients, is that there is more to what the client says, so the verbal communication.
Yes.
And the nonverbal communication. And I think it goes both ways. It's how we receive that information verbally, what we say and how we validate our patients versus how we present ourselves, how we conduct ourselves. So do you want to I can't think of a better person to expand a little bit more on the role of that communication.
Yes. And I want to just add one other thing to what you beautifully summarized there is, and I know everybody listening gets this, what happens in the mind has an impact on the body, and what happens in the body has an impact on the mind. Like you said, it is all one. And so, to know when you are treating a physical symptom, you are like that mindset is such a part of that as well. And, vice versa. So just how those two constantly operate together. And for me, and I think this is where we can lead into the nonverbal piece, I watched it. It was fascinating to me how, a client would say one thing, but their nonverbal cues were something totally different. A quick example of this is I had a rule. This was in every area of my practice. I would not begin a massage or let somebody get on my massage table if their arms were crossed. I know that sounds so tedious, but to me, that was a message that they did not feel safe with me. And
so
how
what would you do if they had their arms crossed?
Oh, that is fun. That's a great question. So, I'm looking and evaluating, is what they're saying matching what I'm seeing in their body, right? So I wanted that congruency, and I'm constantly evaluating for that. So with the arms crossed, there's fun ways that you can do this. And, this is something I learned from my coaching background is, when you first step into a session, Your job is to create connection and rapport with that person. If they do not trust you, no matter what you deliver after that point, either the treatment typically isn't effective as it should be, or they're not going to follow through on whatever you offer them. If they are not feeling that connection with me and that rapport with me, it just doesn't matter. So, and I think I'm going to go a little bit on a tangent here of, I think a lot of clinicians, as you say, practitioners, think that being an expert is in your degrees, in your trainings, in your modalities. We think that that's what gives us the expert status that our clients need to do what we say. And while yes, that is important, the biggest thing that your client needs to know is that you understand, or at least are trying to understand, and that you see them and you get them.
Right.
So,
and that's what really gives you the credibility.
That's where you get credibility. So that connection and rapport, maybe it takes a minute or two extra. And I know a lot of physicians, you don't have a lot of time, but I can tell you, if you spend an additional moment of just, how are you today? What's going on? Hey, find some kind of commonality. Something where they feel like you are on their side. I know we're talking, there's only audio here, but there's this idea of a coaching triangle where a lot of times I think what happens in the patient-clinician conversation is it's the patient-physician talking at the patient and the patient talking at the physician. So it's like this one way, arrows are focusing on each other. And when you create connection and rapport, what you actually do is you and the patient are on the same side. And now there's that third point in the triangle that you get to work towards. Now, you could have that third point of the triangle being like addressing the pain. I would say for me, this kind of goes back to what I said earlier, is, if you both focus on the pain, you're actually going to continue a pain loop. What I would say is when you create connection and rapport, focus towards how the client wants to feel, focus towards the results, the outcomes. And all of a sudden you are on the same page. You have that connection, that expert level standing with them, and they feel like they're on your side. And the first 2 minutes of any interaction needs to be completely solely based on building that connection. And, so finding some kind of commonality, and this fires the mirror neurons in the brain. When they see somebody that they feel like gets them, they're going to trust you. At the end of the day, we all have the weather in common.
Right.
So if you can't find something that you connect with, be like, wow, Anjana, I know we live in the same town. It is humid outside today. I know, right? Right?
Oh my God.
You can always connect on the weather, but just that connection gives them the space where they feel like they're on the same side. So we're talking about nonverbal. Okay, so great. So for me, I would build that connection. And as soon as I feel like somebody is connected to me, what's really fun about body language is you can actually, when you're in rapport, it's like, do you ever feel like when you click with somebody, it's like all of a sudden you're in the conversation together. Do you know what I'm talking about?
Like with you? Yeah.
Yeah. It's like, well, I know, we'll get together, we kind of chit chat, and then all of a sudden it's like we sink into the conversation.
Yes.
Yeah, that. So it's like, as soon as I feel that, what's really fun is you can actually start to what I'll do is I'll match their body language. So I'll actually sit across from them and cross my legs and cross my arms. And I'll wait until I feel like, oh, okay, that click is there. Then I will actually start to uncross my legs and I will uncross my arms, and they will typically follow my body language. That's those mirror neurons happening in their brain. And to me, that signals that they trust me and they're open.
Fantastic.
Yeah.
That is lovely. And I'm going to interrupt for one more second and actually just clarify the triangle for the listeners, just in case we glaze over it or something. It just basically visualize you and the patient or the family, whatever you're looking at, sort of being two endpoints of the triangle, and the third endpoint or third point of the triangle being sort of the positive or functional outcome that you want to achieve eventually.
Yes, that you want to work towards together.
Exactly.
And can I add one thing to this?
Yes.
And I wish we were on camera, because I can do this on camera.
You can draw.
I can totally draw it. Yes.
So we can include that in the show notes as.
Oh, I can't wait.
The therapeutic triangle. Sure.
When I'm creating that rapport, so you do actually have to get that one-to-one. And then what I will literally do when I'm talking to somebody. So one, you're match their tone, match their energy, match their body language, match their words. If they say it's hot and humid name it outside, just pulling the weather one. Use those exact same words. Don't say it's sweltering. I can't even say the word sweltering hot today. Like use the exact same words they use because it sends the message you are on the same page. But as soon as I have that clip, what I will do is I will literally reach out in space. You could do this if you happen to carry like a clipboard or a tablet. For me, I actually would use my massage table a lot. But when I'm in that report, I will like visually like grab the thing we are working towards and I will pull it out of them and move it towards, for me, I moved it towards the table. So that third point was visually in space. I'm hoping this translates because what that did is a lot of times with pain, with stress, with dysfunction, with any of the things that people are coming to you for, they feel like it is them. And so if you're trying to, our culture likes to say fight pain, if you're trying to fight the pain or, all that stuff, there's actually a subconscious belief of I am wrong. I am bad. Something is wrong with me. But when I create that connection, I can actually say, so I know that you're here to talk about, taking your pain and helping you move towards this result. And I will like literally use my hand, scoop it out and put that thing into the third point in space. And so then anytime that now what happens is that now we're not talking about them. We're talking about the thing that is outside of them. And we're a unified team to move towards what it is that they want. Does that make sense? And yes. It's a really cool, if anybody takes that, like play with it. Take the issue out of them, put it on a third point, and then you and them focus towards that thing. If you happen to be somebody who is, I think at hospitals, a lot of times they have like the marker boards on, where you're kind of talking about treatment plans, or if you have a tablet, or if you're showing them any visual, like literally pull it out and then use that thing to work towards it. It gives a sense, it builds trust, it builds connection, and all of a sudden they don't feel like they're alone and it's not the thing that is wrong with them.
That is true. And, I can actually hear some of my colleagues saying, well, sometimes it's more than just, this is great for 3, like one-to-one and like one-to-one interaction. So, but as you very well know, Laura, that especially having been in the pediatric pain clinic, that there's the patient, the parents, sometimes the siblings.
Yes.
And there's the healthcare team. Especially in our clinic where you worked, we were, there was the physician, possibly the nurse practitioner. Yeah. There's the psychologist, the physical therapist. Now we have a social worker, or sometimes even the massage therapist or acupuncturist occasionally in there as well. So, and especially it could be very intimidating if there are like all these people in the room and they're, that whole, even if nobody wanted to cross their arms and legs, they would. They're like, oh my God, there's an army of providers.
Right. Yeah.
I'll give you a tidbit of that. What I used to help people open up and make this a little more comfortable position. So we would go into the room in the morning. They would arrange these 5 or 6 chairs for the healthcare providers, and there'd be like 2 or 3 for the family, right? And there would be basically 6 on one side, and then there would be the 2 or 3 on the other side for the patient and their family. The first thing I would do is I would take the chair and create this circle. Like I would come as close to the patient or the parent, whoever was sitting on one end. And I would just physically move those tables chairs from like being straight lines across each other to the circle. And, subsequently all my team started doing that. Yeah. Then our nurses just started to arrange those chairs like that, just because they knew that's, at least for my visits, that they knew that's what I'm going to do. And that made a huge difference. The other thing that I always used is I would always find, just like you said, a completely non-medical thing. I would watch what they were wearing or how they were sitting or what they were playing with, and I would just comment on that. Or the parent, even if it was about the parents, so something that was completely non-medical that would draw them into a conversation.
Yes, exactly. I mean, like before you can help anybody, they need to want your help. They need to trust you, and let you in. And I think that's genius. And the thing that I find interesting in this, there's a couple things that you actually did subconsciously when you move the chairs. And this is something they teach you when you speak. If you ever get on stage to speak, go on there and move something, like move the flip chart, move the chair, move the mic, like adjust something, because what you do, it's a very subconscious thing that you did. You actually owned the room by moving it. And you did it in a way where you said, I'm the expert. I'm owning the space, and I'm owning the space to include you, that we're on the same side. So there was just in the act of moving it, you built the trust.
Wow. I'm a genius, Laura.
You are a genius.
Training.
I would actually make the nurses leave it the way it was, because what's happening is they probably come in with this preconceived notion that they've been to so many doctors who are talking at them. And to walk in and see that and then change it, all of a sudden it sends that nonverbal message. I'm different and I'm on your side.
Yes.
And then you ground that in just a random, what music do you love? I always talked about SpongeBob SquarePants, what's your favorite movie? And you're right. Kids wear the shirts that unicorns and sparkles and glitter and Avengers. You can always find some kind of thing to connect with. And and so just that thing, you were the expert in a compassionate and connected way.
Right. And that just lets people's guard down. Then they start having a conversation. They start sharing things. It's no longer, oh my God, what are we going to ask? What am I going to ask them? What are they going to believe me, or are they not? It just starts a conversation with you
will get so much more. Yes, you will get so much more information out of that. And, I was always mindful. I know you've been to when I had my massage office, I had the chairs together, and I would always come in and move something slightly and then sit down. Cause I said, I'm here, I own the space, and we're together. It's just this really subtle thing. But I think that space of, from the nonverbal, I'm assessing, what am I feeling, and matching them, because their body will tell you so much more than their words will, especially when you get the teenagers who have one-word answers for everything. I'm just assessing the body language, and I feel that connection, and I can move towards pull out the thing that we're working towards, right? In that intake conversation, for me, that's where I'm, where are you now? What's going on? Assessing what is. And then as soon as we decide what we're moving towards, and you were kind of getting there before, that's where, I think you called it future pacing. I call it leading, but that's where as soon as somebody identifies how they want to feel, my role is to focus them on moving towards that, because human nature is to focus on the pain and focus on what's wrong as a protective mechanism. And so from there, when we say this is how we want to feel, instead of me giving a massage to address the pain, I would give a session that moved their body towards what they wanted, right? And then after that, when they get off the table, do you feel more of how you want to feel? What are the things, for me as a coach, I know it's a little different as a physician, but for me as a coach, I'm okay, so what can you do to carry this forward? What would it look like to take this? And, when you wake up tomorrow morning, how can you take how you feel and apply it in your job? All sorts of things. Or how can you, what's one thing you could do when you get to school that helps you feel this way? I'm using questions that take how they want to feel and put it into their life. And I'm training subconsciously, I'm training them to start to see where the positive is versus where the negative is. So in that future pacing and looking at, so here's how we're going to get there. Here's how we're going to move there. This is the step we're going to take together. That language, and I'm sitting here at my computer, I'm pointing at that third point on the triangle, I'm constantly doing that. And it legitimately creates a feeling of movement and momentum in a really loving and empowered way.
Right. And Laura, you pointed out a pretty important piece here that, yes, but I think it's the same with a physician too. Yes, I might be writing a prescription, but I might take time to explain what they may not recognize as a connection between the impact of other areas of their lives or their emotions or how they carry their backpack or whatever it is onto their physical being. Then we can, and even if I have to write a prescription, an orthotics, a procedure, whatever it might be, but there are still things that you as a physician want to send them out with that are their role, their responsibility, and in their power.
Yes. And you just brought something into my mind that is related to this, is the idea of anchoring. Yes. So I think a lot of times, when you're so you're going to go and take this medicine, or you're going to do this exercise 3 times or whatever it is. When we get into that telling, right? What happens is it puts the responsibility of the outcome on us. So, and I get as a physician, you obviously need to explain and to write the prescription and all of that good stuff. And as a physician, the likelihood of them following you is a lot higher than it is for them following through on what their massage therapist says. So your white coat takes you further than my license does. But for me, what I learned is this is where you can use a really powerful coaching technique of anchoring, where you can say, tell me, what does your morning routine look like? And they can go through and what's your favorite thing about your morning routine? And maybe, I have a nephew who loves the brushing his teeth because he loves the taste of the toothpaste, right? And you can say, great. So when you brush your teeth, I want you to remember to take this medicine, or I want you to remember, when you're doing that fun thing that you're doing already,
right?
I'm going to anchor the new behavior to it.
Right.
So when you think about, don't just say go and do these stretches, take these meds. Maybe ask them, tell me about, what do you normally do on a daily basis? What's that fun thing? Try and find a happy, fun thing. And then, how can we start to anchor in this new habit with the thing you're already doing?
Right.
To increase the likelihood that you do it. And again, when they come up with that idea, okay, they're going to come up with it, which means their buy-in is already higher. They're already doing it anyway. And when you make that suggestion, tomorrow, when that kid brushes his teeth, guess what he's going to think about?
Right.
Doing the thing, maybe even it's the parent. Maybe it's the parent. You can anchor the behavior for them of what are you doing already, and how can we start to implement this into what is already existing?
Right.
Oh, I think you have some background noise there, don't you?
I know. Yes, people. My house isn't on fire, nor is my neighbor's, but there is a fire truck that just going by. And we were in the middle of this amazing conversation. I did not want to interrupt it.
I think we can make do, but just thinking about stuff like that of for me, little tricks like that took my session, cause for me with massage, I would get clients who would be so stressed out in their daily lives. They come into my table and say, fix me. And I'm like, great, I can't fix you, because the thing that's happening is you have this mindset of push and busy. And, I taught my clients a lot of how to breathe.
Yeah.
But I couldn't say, go and, do this breathing exercise. Instead, I could say, okay, tell me about your morning routine. What are you already doing? Okay, what if when you're drinking your morning coffee, right? I want you to take that and just take 2 minutes and do some square breathing. And all of a sudden, the likelihood of them doing the thing completely changed.
Fantastic. No, that's a really, really important point. And I can identify with, and part of this could be our training too. I can identify with a lot of my other colleagues who are trained to be skeptics, And I can hear that saying, but, and so are there tricks that you have, or trick sounds like a kind of a dirty word in a way, but do you have pointers, guideposts that people can use, or physicians or clinicians can use to help them shift that mind frame for their patients, that we're not going to fix it, as in the provider, the physician or the nurse practitioner or whoever or physical therapist isn't going to fix it. We together will do bits and pieces, and we will fix it together.
Yeah. I think, well, that's so much of a loaded question.
Don't you love me for that?
I love you for that. And I feel like we're going to be here for another hour. A couple thoughts that I have that show up for me first is, number one, is me. I live from a standpoint that I am not broken. You are not broken. None of us are broken. So the whole idea of fix me doesn't even exist in my mind. So, and that is for me, my work that cause it's easy because I feel pain and I have goals that I have not achieved yet. And that can all create a mindset of something is wrong with me. I'm not enough. And if you really want to get down, I know we were chatting about my grandma before we started recording today. I really believe at the core of all of this, this is more of my message. I know that this may or may not resonate with the physicians, but I really believe that all of us are already enough. And we spend our entire lives trying to prove that we're good enough to receive love, and as you have met my grandma, I think why she was such a remarkable woman was she operated from a place that she was enough as she was. And so I know that
she was amazing.
She was amazing. And little side note, include this or not, but our last conversation, I am going on a tangent here. Is that okay?
Yeah, of course.
Our last conversation, we were talking about stress and pain and this idea that, all of us we are already loved and enough and whole human beings. And so many of us spend our entire lives trying to prove that when we don't need to. And we were actually talking about faith, how all this world together is a whole nother podcast. But I asked her, I was like, why do you think people struggle to have faith? And she said, because most people don't feel that they deserve to be unconditionally loved. And it's in that space that we create disconnection. And so I think that when people come into your office saying, fix me, like that belief that they are already whole and enough is absent.
Missing.
Yeah, is missing. Yeah. So for me, I have to do my work and walk into that office saying who I am is enough. Yeah. I'll laugh because Anjana, I have so much love and respect for you. And when you're like invited me onto the podcast, I heard that voice in my head that's like, well, who are you to do this? You're just a massage therapist talking to physicians, blah, blah, blah. And and so that was that opportunity to say, no, you're enough to be here. You have something valid and to offer. So I go into a session looking at the person knowing that nothing is broken. So that's number one. Number two, if somebody comes in and, just language wise will fix me. And for me, I got it more from the parents and more of my adult clients than I ever did from the kids.
Correct.
So that was really an educational piece of when you use that coaching triangle, say, look, we're going to do this together. Like one, you're not broken and we're going to work together to help you feel more, to help you have more of this outcome.
Right.
And so that using that language there. Now, for my adult clients in my private practice, that's where I can have a deeper conversation around, what are you doing in your daily habits that are making you feel this way? Yes, you're feeling this stress and pain. Well, what do you think you're doing? Tell me about those habits right now that might be leading towards this and what needs to shift as we move forward to give you more of what you want. So I would always put the responsibility back on them. So those are a couple ways that I would do that in releasing the responsibility to fix.
No, that's extremely helpful. And just for the listeners, Laura, how old was your grandmother?
She was 102.
She was a psychologist when there were none. And this is a woman who paved her path professionally.
Yes.
There wasn't any path for psychologists, especially females. And so she was so full of wisdom, so amazing.
And and to add to those accolades. So yes, she got her PhD in psychology when she was a preacher's wife and had 3 kids. So like that, I have so much respect for her in that regard. And she ran a children's mental health clinic. And this was 60s, 70s. She introduced mindfulness programs in these children's mental health clinics way before mindfulness was like all the rage, before the buzzword of mindfulness, before Deepak Chopra and all of them came along.
World.
Yes. Yes. Thank you for the clarification. Yes, exactly. Thank you for the clarification. So yes, so she in the Western world was implementing a lot of these strategies for children's mental health way before they were, ever a thing in our culture. So just so wise and loving and brilliant. It's like, why didn't we think about having you interview her for this podcast? I know.
Well, I met her at 101 and she was sharp as a tack. What an amazing woman. I am so honored that I had an opportunity to be in her presence and hear her wisdom. Oh my God, what a blessing.
Yeah.
Laura, anything else that you any last message? I know we can have these conversations. We'd be here for 4 hours talking.
I know. Maybe there's a part 2 to this.
There should be.
I think. Well, we can arrange that. So I think as a clinician, and I think you already know this, and I just want to reiterate, how you talk to your patients matter. It matters just as much as the treatment plans, as your education and your experience. So much of the healing process happens when somebody feels heard and valued, and that all comes through the conversation. And when you have those tools to really, for me, it's like you're holding somebody in that treatment, in that session, in that appointment. Really small, subtle shifts in the conversation. This does not have to take 45 additional minutes. I know you guys are limited on time. Just a few minutes. You can create trust. And when you shift the focus on what you're actually moving people towards and bring that buy-in for them, like internal motivation to change shows up. And it's so important. And I know physicians are now learning more about the communication and how important that is. It's small, subtle questions, words, how you literally position yourself in the room. All of that matters towards the patient's healing. All of it does.
Yes.
Yeah.
Amen.
Yeah.
I will add one more little.
Oh, good. I can't wait. Yes.
That it's never too late. There isn't a perfect time when you start doing this. Is the perfect time. It always matters to your patients. It will always matter to your patients. If you didn't do it then, do it now. If you haven't,
don't let it be mechanical. People can feel mechanical. They can feel inauthenticity. If they're, oh, how's the weather? It's nice out. Okay, so now let's talk about your headache. Yeah, they can freaking feel it. I have this thing of feel my feet. Sorry, I'm going to jump in here. When I walk into a room, I feel my feet, because when I feel my feet, I can only be here and now with the person. And it gets me, even though, yes, maybe I'm asking the same 3 questions, it gets me grounded in the moment. So I'm actually present to the person.
I'm right here. Yeah.
I'm right here. Feel my feet. I mean, even just doing that, boom, I'm here.
And you can even ask, especially with children, they are
they know.
Yeah.
Oh,
and they're suggestible too. So even if they are distracted, you can do that simply with them. Just tell them, what do you feel under your feet? Mm-hmm. They're like, what? Yeah. And that might be your conversation starter.
Yeah.
So
here we go again, right? Yes. Yes. Please be authentic. Don't let this be mechanical, or because they know. That's the thing about kids too. They're kids. The kids want to be present. They want to be in the moment. That is their natural tendency. Mm-hmm. Meet them there, be there with them. And I think now I'm going to add more. I know for me, I think there's this idea that in order for us to be professional, we have to cut ourselves off from this kind of stuff. And so still be you, especially with kids. I would talk about my favorite Disney movies, or, I would make little jokes. Be you. They know. When, especially adults, they know when somebody is being honest and being themselves and when somebody is not. And kids especially are going to trust you a whole lot more when you are actually being yourself.
Absolutely. And when the parents see their children trusting you, they trust you. That. Absolutely.
Yeah.
What great wisdom, Laura. Thank you so much.
You're so welcome. This is not at all what we planned to talk about. So let's do another one.
That's right. But it is so important though. This is sort of what we wanted to talk about, but I think this got such a deep and philosophical conversation, and I love it. I think it's really important because this does drive our day-to-day lives, our day-to-day connection with our patients and families. And this is what really drives the direction of their outcomes.
Yeah.
So, and because their outcomes are good, so direction of the outcomes that we want for our patients and families. So I think overall it was a win-win anyway.
It's fantastic. I mean, yes, you have to have the mindset buy-in to move forward, all the things. And it's such a powerful process when you can and it's small, it's subtle, but it has such a huge impact. And, play with this. I hope you guys can take some of the things we talked about today and play with them and implement them and test them and be skeptical and try the coaching triangle, see what happens.
Thank you so much. This was fantastic. And I can't wait to have you on the podcast again and again.
Woo-hoo, fantastic.
Maybe we can even talk about massage sometime.
We can totally talk about that too.
Great. Thank you so very much.
Thank you.
So there you have it. So much great stuff that you can adopt and put in your practice right away if you choose. Check out the show notes and try the therapeutic or the coaching triangle that we discussed, or any of the other tips that resonate with you. Please take these skills and use them, test them, make them your own. See what works for you and your patients. Then let me know in the comments and in reviews of this podcast. I can't wait to hear from you. Also, If you haven't yet subscribed, please do so, such that you don't miss out on any of the new or the bonus episodes. Also, if you can take a moment to leave a review, that would be tremendously helpful because this helps the podcast get to more people who might benefit from it. And they may need it even more than you do. You'll be doing them and us a great service. Thank you again for tuning in and for your support. I'll be back with another episode in 2 weeks. Until then, stay safe, stay proactive. Bye now. Pedia Pain Focus is brought to you by Proactive Pain Solutions, a company committed to improving the access, quality, and expertise in pediatric pain care. Through our online education and consultation for clinicians and institutions, we're transforming pediatric pain medicine. We're creating experts and leaders in the field and empowering patients and families with knowledge and tools for self-management to live a functional life. If you wish to advance your pain care expertise or improve the operational performance of your pain care services, please give us a call at www.proactivepainsolutions.com.